West Yorkshire, home to nearly 2.5 million people, 70% of which have experienced a traumatic event during their lifetime. In this mini-series, we'll be taking a deep dive into the West Yorkshire Adversity, Trauma and Resilience programme, jointly delivered by the West Yorkshire Health and Care Partnership and the West Yorkshire Violence Reduction Partnership. The programme aims to prevent harm and improve the well-being of the population. Let's hear about some of the work that's been going on in the partnership.
I think we're still relatively early in our journey, but I think what we're doing now, what we're looking at doing now is really thinking about working at 3 levels. So I think the first level is really about preventing trauma and adversity in the whole population and building resilient communities. The second level, I would say, is really thinking about people that are at increased risk of being impacted by trauma and adversity, and really embedding trauma-informed approaches in services that they engage with. And then finally, you know, we have got people in Calderdale, and because we're small, we can know a lot of them personally who are really severely impacted by trauma and adversity, and really looking at how we really join up the support, take strengths-based approaches and really build resilience in those individuals. So a good example of that is the work we're doing with family hubs. So we're developing a family hubs approach. We're really joining up support for families, really engaging families and using co-production approaches to develop a family hub offer that's universal across Calderdale, very much working with families and being led by families, but taking an approach where we're starting in the areas of greatest disadvantage and then rolling out across the whole of the borough. And the second example I'd give is around building resilient communities. So we're doing a lot of work to sort of use resilience building approaches. So we're doing a community-led approach to the regeneration of parts of Halifax. So we're actually involving communities we're sharing power, we're sharing money with them and letting them decide what happens and how money's spent, but also deliver and spend that money themselves to build resilient communities. And then in terms of the sort of second level, the services that people that are at increased risk of having experienced adversity and trauma, we're really trying to embed skills and knowledge in trauma-informed approaches across services. So, for example, Neve and I were talking to a police colleague earlier today, and he was telling us about all the great training, all the great work they've been doing to really build knowledge of trauma-informed approaches there. We're also in the process of setting up a network, a network right across our system, so people from each different part of the system to work as a network so that we can think about what we learned from the West Yorkshire programme, what we can feed up to the West Yorkshire programme.
Soon after the Burnt Bridges report, we became a meme authority which harnessed the work, and this is about focusing on the adults with those incredible levels of trauma and suffering multiple disadvantage. And I think there's 2 pieces to the work. One is to do better with those that are still with us, but all the time it's giving us insight into prevention. A really good example being care leavers. How many of them have had a care experience? How many of them have not been diagnosed with ADHD, but it's obviously an issue. So it's working on both sides of the coin in terms of doing and preventing.
The journey to become trauma-informed in Wakefield has really been supported by the West Yorkshire programme, because what it's given us is a unifying ambition and an opportunity to really draw all the different bits of good practice together and have a common language that we can use with each other and a real sense of common purpose. I think we've also been in a position to draw in different services that may not have traditionally thought that it was their role to be trauma-informed. So some really excellent work with our housing providers, our police service, which is really then building up that community of practice and that connectivity, which ultimately will give residents in Wakefield an experience of experiencing trauma-informed services no matter who they turn to.
Calderdale and Huddersfield NHS Foundation Trust have a unique way of connecting with young people as individuals.
So our trauma-informed approach is very different to what other people can offer. So what we do is when a young person enters A&E, we make that first initial meeting, then we ask for them for their consent to do a follow-up within that community aspect. When that follow-up is done, we ask them what more they're interested in, and that's when it leads to more. A lot of the time when young people come into A&E, it's very short and simple, so our community offers them to be more open. That leads us to being able to get involved in schools, get involved with antisocial behaviour, get into drug and alcohol services. We offer taking them to places, we offer taking them out just to be able to learn how to be social, and we do just little bits of stuff like that. There is no time limit on our support. The young person decides when to end the support. That can be 4 weeks, that can be 6 weeks, that could be up to 6 months. It really just depends on the young person.
Other partner organisations within the programme are focusing on improving their whole communities by challenging existing mindsets and processes.
I think the work that we're doing around adverse childhood experiences within several of the modules that we're delivering on the Masters at the moment is, again, it's kind of moving towards changing mindsets around kind of discipline in schools and the ways that trauma can manifest in children's behaviours in schools as well.
And there's a huge crisis at the minute with students refusing to go to school. You know, all too often relationships break down in schools and children just do not want to go to school.
But what is that about? Why have we got this increase in school avoidance? Well, you know, children, in order to engage with and attend school regularly, need to feel psychologically safe, and we can promote them feeling psychologically safe by giving them healthy, consistent relationships with, you know, amongst the teaching teams, amongst the staff that work within schools, and promoting that within the school community, rather than you know, as you said before, Richard, promoting more punitive strategies and policies which actually seek to isolate children and young people and not make them feel part of the community.
We can't do this without our communities. We absolutely cannot embark on a journey which talks about how do we address everything in relation to adversity, trauma and resilience without our population, without our communities. And Bradford is such a diverse, thriving place. And in order to do it well means that we've got to co-produce, we've got to talk to people, and that's exactly where we're at as a programme right now.
What happened to you is really important, and being able to understand the impact of that is really important. But the most important thing is that you can take ownership of it and you can move beyond it. And so I'd really love to emphasise the resilience piece and the way in which people can take back control of their lives.
That's all for part 2 of this mini-series looking at the West Yorkshire Adversity Trauma and Resilience programme. In part 3, we'll look forward to the programme's aspirations for the future and the definition of success.